Hello, and welcome to my therapeutic relationship report. Our objectives today are to identify what components constitute a supportive therapeutic environment, discuss the role of empathy in establishing a positive client-provider relationship, look at the spirit of motivational interviewing. We want to review the skills needed to identify and promote change talk with the client, as well as explore how motivational interviewing can enhance the trans-theoretical model as an effective combination for behavior change. So, what components constitute a supportive therapeutic environment? Well, first we can look at the external environment. This can reduce or eliminate environmental stressors, provide positive distractions for the client. It can help enable social support and can also give a sense of control to the client when they're in the proper environment. All of these are very empowering and allows the clients to open up whenever talking to their practitioner. So what factors can the practitioner control? Well, they can control the relationship factor that they have with the client. They can also control the environmental factors when they are in session with the clients. They can control their involvement, their emotions, and the culture surrounding their sessions with the clients. They can also control the thought and the time that they put into the session with the client. Literally, they are involved and can control the conditions and techniques that they use whenever they are with the client. So, what is the role of empathy in establishing a positive client-provider relationship? Well, first, we need to look at empathy as the ability for the provider to understand a client's situation, their perspective, and feelings. They need to be able to communicate that understanding and check its accuracy with the clients and then provide help in a therapeutic manner. Right? So the ability for a practitioner to establish an empathetic relationship with a client is essential for a great and successful provider-client interaction. There was an interesting study published by Joanna Shapiro that showed that training within medical students, as it progressed, their expression of empathy towards their patients reduced. And her major argument behind it was that this was a biological process that the medical students were going through. They were mentally separating themselves out and protecting themselves by focusing on the medical modalities and not the emotional components of dealing with their clients to make sure that they were sticking to the medicine and not acting on emotion, which I thought was very interesting. So it begs the question, are we biologically programmed to decrease empathy as we work with clients? Something that needs to be explored. A few key concepts are really essential, though, to a successful integration of empathy into a practice. The practitioner needs to show concern or empathetic resonation. The clients need to make sure that they feel that their practitioner is being empathetic. They need to make sure that they're paying attention, that they're establishing a proper connection and showing proper understanding, so the affective and cognitive portions of the interaction with the client. And then their communication and the authenticity of that communication needs to be apparent and very intentional by the provider. And then practitioner support is always a big thing, making sure that the client understands that they have that support and that understanding from their practitioner allows them to be in a safe space to go ahead and accept and receive any information that they may be getting from their therapist. So now we're going to look at the spirit of motivational interviewing. Motivational interviewing is a client-centered, practitioner-led autonomous guidance that elicits motivation for change. The importance of using provide illicit framework within a session is very key to the process. What we want to do is we want to make sure that we elicit the emotions and the reasoning from the clients for whatever behaviors they want to change or whatever behaviors they may be doing. Provide them with information that will allow for positive change, and then elicit that motivation and that emotion that will lead the client towards that positive change. When done correctly, the client's autonomy is preserved, and a plan of action can be incorporated long-term for the client. One of the things that I love the most when looking at the skills needed to identify and encourage change talk was the acronym DARN-CAT. This is desire, ability, reasons, needs, and then commitment language, action, and taking steps towards change. So basically the word DARN is all of the pre-work that goes into the behavior change for the client. So we're assessing their desire and their ability to get motivated and for change, their reasons for change or not for change, and then the needs that they have to go ahead and accomplish that action-oriented behavior towards change. CAT is really getting them into that action-oriented change. So we're looking for commitment language, we're looking for action within the patient, and we're looking at them to take steps towards change. So actually physically and mentally making those adjustments. And so when you can follow this this acronym as a prescription and as a guide, you can really walk through the whole process when identifying and encouraging change talk within the clients. So using motivational interviewing to enhance the trans-theoretical model seems to be a very strong relationship and therapy practice or counseling practice. The practitioner must establish the client's current readiness for change, obviously. If the client is in the pre-contemplation, contemplation, or preparation stages, motivational interviewing can be very powerful in helping the client move towards the action and maintenance stages that we want them to be in for change. Motivational interviewing is great for helping that elicit that positive action-oriented change talk. It allows the client to get into that space to mentally make adjustments and go from that sustained negative talk more towards that action-oriented change talk. And that's the voice that we really want to foster whenever we're working with our clients. And motivational interviewing is also a great tool for helping prevent regressions and motivate clients during the action and maintenance stages. Not everybody gets to action and maintenance stages and stays there. Things happen and they can regress, and motivational interviewing is a great way to get back into that engagement zone with the client and get them back into that positive self-talk and change talk. Thank you for joining me today. I appreciated having you.